USMLE, Step 1. Year 2024, number 0988. Which of the following beta-lactam drugs has good activity against beta-lactamase-producing organisms and penetrates readily into cerebrospinal fluid? A. Digoxin. B. Imipenem. C. Cefazolin. D. Ticarcillin. E. Clavulanic acid. F. Amoxicillin. The beta-lactamase inhibitors bind to beta-lactamases and inactivate them. They themselves have little direct antimicrobial activity. However, when combined with an antibiotic, they extend the antibiotic's spectrum of activity and increase stability against beta-lactamases. Unfortunately, they do not inhibit all types of beta-lactamases. Examples of beta-lactamase inhibitors: clavulanic acid, sulbactam, tazobactam, avibactam, durlobactam, relebactam, vaborbactam, enmetazobactam. Imipenem is a synthetic beta-lactam antibiotic belonging to the carbapenems chemical class. Carbapenems are highly resistant to the beta-lactamases produced by many multiple drug-resistant gram-negative bacteria. It is usually administered through intravenous injection. It inhibits cell wall synthesis of various bacteria. Because it remains very stable in the presence of beta-lactamase, both penicillinase and cephalosporinase, produced by some bacteria. Carbapenems have a better rate of cerebrospinal fluid, CSF, penetration compared with other beta-lactams. Meropenem and imipenem penetrate CSF and achieve therapeutic levels against meningitis. Imipenem is not typically used due to the increased risk for CNS adverse effects such as epileptic seizures. However, imipenem cilastatin has been used to treat pneumococcal meningitis when failure of third-generation cephalosporins occurs. Several anti-infectives, e.g. isoniazid, pyrazinamide, linezolid, metronidazole, fluconazole, some fluoroquinolones, are extremely valuable for the treatment of CNS infections, because they can penetrate the blood-brain barrier, BBB, well. Direct injection of drugs, which do not readily penetrate into the CNS, into the ventricular or lumbar CSF, is indicated when other effective therapeutic options are unavailable. Avibactam is a non-beta-lactam beta-lactamase inhibitor that is available in combination with ceftazidime. It is used for the treatment of complicated intra-abdominal infections in combination with metronidazole, and the treatment of complicated urinary tract infections, including pyelonephritis, caused by antibiotic-resistant pathogens, including those caused by multi-drug-resistant gram-negative bacterial pathogens. As there is limited clinical safety and efficacy data, it should be reserved for patients over 18 years old who have limited or not alternative treatment options. The answer is B. Imipenem.